Hi y'all, this is BBW to Skinny Fab. I am starting my weight loss journey. That journey will include the gastric sleeve surgery. So far, I have taken a few steps towards that goal. I have gone to my surgical talk for the community, which they just go over the different types of procedures that they offer and the pros and cons of each individual procedure. They also answer any questions that you might have. After that, they schedule a appointment with your surgeon. I got to meet my first surgeon appointment on January 15th, 2019 with Dr. Smith. He went over the two different types of procedures that he thought were best for me, which was the gastric bypass or the gastric sleeve. Me personally, I was already stuck on the sleeve because I've done multiple research on YouTube. I looked things up on Google. I got pamphlets from doctors, and I just thought the sleeve was best suited for me. The only downside of me getting the gastric sleeve is I cannot take one of my medications, which is meloxicam, also known as Mobic, for rheumatoid arthritis. Now I can substitute that with Tylenol arthritis and try that and see if that's going to work for me, which I've started. It seems to help a little bit, not as much as the meloxicam. But the gastric bypass has so many more complications. And I've had family members have that, and then later down the road, it was like 10, 15 years afterwards, they regained the weight, they stretched their stomach, all different things. And I just thought it was in my best interest to just try and work with the sleeve. Now, my surgeon gave me a handy little check sheet because my insurance, you have to do 6 months pre-op program, and some insurances do 3 months if you're lucky. So far, I have done the blood work. I have done the breath lab. I'm not quite sure what it's called, but they used to do a stool sample. Now they do the breath thing, where you take a breath in, you hold it for a few seconds, and then you breathe into this tube, and you fill up this bag. Then you drink this clear liquid that doesn't really taste like anything, but once you sit there for a little bit, because you have to wait 15 minutes, your stomach gets a little upset, you kind of feel nauseous. But luckily, while I was waiting for that, they did my EKG. So then after my EKG, I did the same thing. I took the bag, I took a breath in, held it, and then breathed into the bag to fill it up. Next, I'm going to have to get a chest x-ray before my cardiology appointment, which is February 11th, 2019. You have to have it at least a week before your appointment. Also, I have my first nutrition class, which is on January 21st, 2019. You have to complete 6 classes for bariatric weight loss management. Then you have to do a sleep apnea test. Then you have to do a psychiatric evaluation. They told me not to freak out about the evaluation. They said a lot of patients get nervous, and pretty much it's just a thing to help you understand where you are mentally, emotionally, and to give you the tools that you're going to need to help you succeed after you have the surgery. After you complete all that, then you make an appointment with your surgeon, and they'll go over all the results, and then that's when they set you up with a surgery date. So far, it looks like mine's gonna probably be in between July and September, because they said the insurance, after you do all this, it takes about a month for approval. We went over the different health problems I have, which I have knee and hip problems with arthritis. The insurance wants you to be either 35 BMI plus with a medical problem, or 40 BMI plus. Me, I am 41 BMI. Actually, I believe it's 41.8. And then I have my arthritis in my lower half, which probably is due to my weight. I weigh about 257, I believe it was, and I'm 5'6". Hopefully this surgery is going to allow me to gain confidence and be able to keep up with my family. I have 2 girls. One is 7 and one is 4. And then I have a loving husband. And just being able to keep up with them and do all the things that they love, and then me not feeling ashamed or embarrassed for my children or my husband that I'm overweight and things like that. So I will keep you guys up to date with all the appointments and let you know how everything's going, so you guys can get an idea for if you decide that gastric bypass or the gastric sleeve or the lap band is right for you, because it isn't about others. Before my husband, I was in a relationship where I was going to get gastric bypass done, and I went to the first class, and he pretty much wouldn't allow me. He was afraid that if I got the surgery, that more men would be into me, and that would ruin our relationship. But what it was is he was insecure about himself, that he didn't treat me very well, so that's another thing. So if I caught eyes of men and they were treating me better, he was afraid I was going to leave him. Luckily, I got out of that relationship, and I'm with the husband I have now, Paul. He's very supportive in everything I do, and I'm so glad that I have him and my parents and my children in my corner to help me proceed with all this. And yeah, I guess I'll talk to you guys next time, and have a good day. Bye.